I guess to ensure that your weight loss is sustainable and successful, it is important to engage in healthy lifestyle modifications through diet and exercise. Ensure that you are in calorie deficit, which means that your energy intake, like your food, should be less than your energy output, such as your metabolism and exercise.
Yeah, so this can be done by 3 main points. First, reducing calorie-dense food and drinks that are high in fat and sugar and alcohol as well. 2, increasing food high in fiber such as fruits, vegetables, and whole grains. This will help you feel full for a longer period of time. And lastly, point 3, practice mindful eating. Ask yourself, am I hungry? Okay, if you're not, don't. Just stop eating when you feel about 70% full. Calorie counting is essentially counting the amount of energy consumed from food and drinks. Intermittent fasting is a subset of calorie counting. It involves restricting calorie intake intermittently for a predefined period of time, and this could range from several hours a day to a complete 24-hour period.
It is known that calorie restriction can help to improve insulin resistance. However, currently there is insufficient evidence to show that intermittent fasting is superior to restriction of calorie intake in controlling one's weight and blood sugar levels. So for those people with diabetes, we generally encourage regular meals and meal timings. So your dietitian will be able to advise you based on your health needs.
I like to work with children and young people because they are generally moldable at this age, and working with them to be able to help to improve their life towards better health is fulfilling. What about you?
I like the challenge of managing complex medical conditions, especially those that affect a child's diet, because some of them are very rare conditions and they require very specific diets. One example is those with patients with phenylketonuria. Those patients require a specific diet that limits their protein intake. And when I'm able to help them fulfill what they need, it makes it very fulfilling as a profession. So working with children who have very selective feeding behaviors can be very, very challenging because often they are very specific about what they like to eat, and especially those with autism, I think they are very, very specific about what they want to have at every meal. So we actually work together with child psychologists as well as a speech and swallowing therapist to help them to manage these behaviors by coming up with very positive feeding habits, as well as making sure that the foods are of acceptable textures for them as well. Yeah. How about yourself? What do you face as a challenge as being a pediatric dietitian?
My biggest challenge is when the children they lack insight into their condition and they have very poor motivation to change. So this makes it difficult when we ask them to make changes that they're not used to. So working with their caregivers are very important. Yeah. Ketogenic diet has been found to be very effective in adults. However, this diet is very restrictive and can lead to growth deficiencies for children and young persons. Some side effects include poor concentration at school and poor mood. So not only that, but this diet is very restrictive and it's unlikely to be sustainable in the long run. So if a child needs to lose weight, we recommend the healthy, sustainable method. Yeah. But I understand ketogenic diets are used for certain conditions.
Yes. So we do use ketogenic diets for children who have seizures, particularly those who want to seek an alternative way to control their seizures. So we do have to take into account their specific diet preferences and come up with certain diets that are in that ketogenic ratio to help them to possibly manage their seizures a bit better.
Happy Dietitians Day!
Thank you! Happy Dietitians Day!
Thank you! Happy Dietitians Day!